Welcome, everyone, to Talk Back. This is the third program in a series of four programs about Dr. Epstein, mindful healing, living questions. In the last two sessions, we introduced you to Dr. Epstein's method and philosophy, and we talked about question number one, which was the narrative story. What is your story? How did I come to be this way? And today we're going to tackle, as you just saw on the screen, question two. Am I willing to listen to the ears of my heart, to the other voices of myself speaking? That's question number two, living question. So let me introduce again for our program three, Dr. Paul Epstein. Hi, doctor.
Hi, thank you.
Okay. And I think it would be helpful for a short summary of how we've come to this living question number two. Give us a brief summary of the first two sessions so we can move on.
Well, we explored the basic start that disease tells a story, not just of your cells and your diagnosis, but of yourself, of your life. And as a holistic doctor, I've learned we need to listen to both stories. And part of that is to engage in healing and exploring our biography. So we're talking about integrating in care the biography and understanding what happened and the story of the life and stress and trauma and the symptoms and the disease and the biology. And so that's an integration, not an either or, it's a both and. And over the course of my career, I've evolved some living questions to begin to bring those elements of care to the patient and to their healing. And we explore the story of their life, of their stresses, what happened. We briefly acknowledge the science that we now know adverse childhood events and trauma and stress contribute and are leading causes of chronic disease, of symptoms that we suffer from. And the phrase, the body mind bears the burden, those traumas, those pains, those stresses. We survive them, we get through them, we learn from them, we adapt and adjust. But many of those pains, those stresses, those experiences, we don't have the resources, we don't have the ability to process them. So we bury them, we carry them. And part of what we do is protect ourselves from the pain of them because we can't feel them. We're overwhelmed by them. So we bury them. And they show up in the doctor's offices with our ailments and diseases that need evaluation, need diagnosis, need treatment, which is our approach uh, holistically, is to make sure that's part of the equation, the identification and treating of the disease. But we're going deeper. How'd you come to be that way? So that was question one. And what I'm finding in my journey is to engage the patient further, to see with new eyes, to look at their illness, to see pain as a teacher and their illness as an opportunity. We have to listen. We have to go to a deeper level of listening to the symptom, listening to the inner wisdom, asking questions. Are you willing to listen to the voices? Maybe that pain is saying something. Maybe there's a meaning and a message and an opportunity in this while we're diagnosing and treating and making sure that you're getting better on a biological level. The connection in mind body biography biology is also present and needing to be engaged and integrated. And the first part we called narrative medicine. We acknowledge the science now of understanding that, and schools like Harvard and Columbia have programs for doctors in integrative medicine and narrative medicine. So that's been my life work as a naturopath, bringing this element in and learning tools and therapies and techniques of imagery and guided imagery and various psychotherapies and internal family systems to guide the patient. The healing comes within them, to guide them to understand and heal a relationship with themselves and their wounds, maybe living in the body as a burden. And so our focus the next two sessions is how do we listen? What's that process of listening? And then in session three, in living question three, in the next session, the last session, we'll explore how to be with it. And the focus there is to embrace it in a way that we release it, that we unburden this pain, this stress, these difficult memories, so they no longer are causing the disease. It's like a simple way taking out a splinter that's been in there and it gets infected, and we keep treating the infection, the effect, but we need to remove the splinter. Sometimes these deep wounds, these stresses, uh, the pains and grief and fear and shame and guilt, these deep wounds and painful emotions from what happened to us. This isn't blaming anybody or judging anyone. This is coming home to ourselves and unburdening and letting go that which we may have carried, often unconsciously, which again brings us to guided imagery and living question two, am I willing to listen? That's a tool that sort of turns off the left brain to figure it out and to fix it and to get rid of it. And we're listening, we're exploring, we're engaging, we're hanging out in the unknown. So that's a brief overview of what we've covered in the first two. And sessions that we've had, living question one and living question two and three will follow. And today we're going to explore, am I willing to listen with my heart to the other voices of myself speaking?
So I've gotten questions, and I want to know too. You use the expression living questions. Why do you use that term rather than my philosophy, my theories, my three answers? What does living questions really mean?
I think the context there is in this process of looking at illness in a new way, of integrating, seeing it as a teacher, of relating to it not from what's wrong and how to fix it and how do I get rid of it, to being willing to listen. And it's a process. It's an unfolding process. It's hanging out in the unknown. It's not knowing. It's an exploration with a compassionate curiosity, and the healing happens in the moment. So it's living now, uh, and we're not so much seeking the answer, uh, which will come. The insight, the truth will show itself. It's a painful truth often that we carry. But if we live the question, it's be with it now, in the moment, explore it, tell your story about it, listen to it. In next living question, how to be with it, and those aspects are alive in the moment. Healing happens now. So I use the phrase, we're living the question. The question and the experience of living it, seeing it with new eyes, being with it in a different way, changing how we look at it and changing how we be with it. That's the healing. In the heart of that experience is the transformation happening, not that effort, which we'll talk about in session three of how to be with. It is being with and living that question and exploring it and letting the truth come. It gives us a little space from the parts of us that are too much wanting the answer, too much wanting to fix. We again integrate that in treating the biology, in treating the disease, but we're treating the person. We're looking at deeper underlying causes. We're exploring a process of healing, not curing. We want both to take place. Sometimes the healing will support and be the curing. Sometimes there's no cure. And the healing is, how do I be present with it in a healing way? So these are aspects. So I use the word living questions as a way of an engagement, a process that's ongoing with patience and exploration and curiosity and compassion.
So you talk about listening with the ears of my heart. So I ask for myself and others, how do I find, where are those ears in my heart? How do I find them and get to them? What does
Well,
that mean in practice?
there are some tools that we use, some therapies that I use to live these questions with the client, with the person, to guide them. Narrative medicine is a tool. Writing your bio for me is a tool. Exploring what happened is a tool. Adverse childhood events questionnaires are a tool to begin to live those questions in that way. When we say from the heart, it's a part of us that's wounded. It's not responding to, I see you and I'm going to fix you and get out of here. It's responding to, it's a pain. It's been hiding away. I had in my office, I used to have a little kitten, uh, a puppet kitten, like hiding with just a head peeking over the top. To me, that's the wounded child, the the injury in us, the pain in us that was hurt in any number of ways that we've spoken about, that got buried away. It's scared. It's helpless. It needs love. And we need to create a space, a healing environment that's safe for it to come out. So, I would look at that with my patients and I'd have them look at that as we would go to this aspect, and then we'd look up there and we'd see this little puppet. There's a little kitten there. He's a little frightened. He's just peeking his head out. In that space, we hang out. We give space. We be present with. This is mindfulness practice, compassion practice. We hold it. Yes, we want to find out. Yes, we want to heal it. Yes, but we create a relationship to it with mindfulness, with compassion, with different therapies, with narrative medicine. And today we're going to go a little deeper because this was profound for me in my evolution as a doctor and my therapies and skills to do just that, to touch with the ears of the heart and to help people listen. Listen to the symptom, listen to the pain, listen to the disease, listen to the inner wisdom speaking to them. And to do that, we have to stop, calm down. This is where my training as a yoga and meditation teacher was helpful. I'm a New Yorker. I got high energy and I'm pretty intense. But thankfully for me in my healing, mindfulness, meditation, yoga help calm me a little bit, find a little peace in the storm. And as a yoga teacher, it helped me when I'm with my patients. They don't need me always to be the one fixing them and doing and telling them this. They need someone present with them to just listen and be present. Yes, I'm working these other angles and what you refer and how to integrate different pieces of their components and elements of their healing soup. But to go deeper, to look inside, to be willing to listen, I have to create a space of safety and calm that I can bring in our relationship, and mostly for the patient to trust to be that way with themselves. After all, that's the healing. The healing is a patient's relationship with themselves and the parts of them that are wounded, and to recognize they have a part of them capable of embracing that pain. Remember, we said initially the pains and traumas of the past, of childhood in our life, and all the sufferings, they're not lost, they're embodied. So we carry it and we're creating a space for it to feel safe enough to peek out and show itself. And that will be the next session, how to be with that. So we let it go. We don't want to carry it. But to do that, we have to face the truth of it, feel the pain, and heal. We'll speak more about healing the grief and painful emotions and guilt and shame and trauma and anger and what people go through when they're abused and abandoned, and they carry it. So we'll speak more about that with some cases that we'll discuss. But that answers that question, I think, Sheila. An excellent question about that that process of creating that space to open, to listen, to see with new eyes. And those new eyes are the patience that when they change how they look at it, when they change how they be with it, that shift in relationship is what creates the environment for that healing to take place. I'm a witness, observer, participant, creating that space for that final sort of letting go, or as I like to speak of, which I'll mention in next session as well, a remembering. Because it starts by we reject those wounds, we push them away, not because we want to, but because we have to, because they're too painful. We don't have the ability to deal with them in that time. We give people an understanding they have that place in them that has the capacity to embrace it, to love it, to open to it. And the first part of that process, leading to the healing, leading to the letting go as a process, is listening to the symptom, listening to inner wisdom, which is a different experience than what do I got to do to fix it. This is the healing. And we know listening itself is therapeutic. An interesting sidelight before we maybe share an example with a patient. I teach a lot about the therapeutic relationship as I mentor and train doctors and workshops and things that I've done over the years. So I've done some research, and this is partially psychotherapy when you're looking at trauma and stress and people's childhood. Even as I shared before, when a difficult case or a complex case or more support is needed, we'll refer to the specialist and the patient. But now we're integrating the mind and body. So there is this sense of an opening to that wound and helping the doctor recognize that who they are is as important as what they know, and how they be is as important as what they do. And the same applies to the patient, who they are and how they relate and how they be with it, as opposed to what should they do about it. And again, we're integrating all of that, not either or, a both and.
Okay. Now, I know there are a couple of quotes that you find very important. So I'm going to go to our slides to find the quotes that I think you are looking for. Um, can you see this slide by Dr. Jack Cornfield?
We read that last time, and I asked you to read it again because it's, and he was my first meditation teacher, and so it says it all.
Okay, so when any experience of body, heart, or mind keeps repeating in consciousness, it is a signal that this visitor is asking for a deeper and fuller attention. Under all the tears, the pain, the fear, and the anger we have contracted ourselves around, we can find freedom, joy, and ease in the face of all life. Why is
This
this
is
such an important
well,
quote?
this is what the living questions are about. Is recognizing that our pain and that disease tells a story, and we have to listen to it. And it reminds me of a quote from Einstein as well, who said, paraphrasing, "You can't solve a problem with the same consciousness that created it." And our experience in consciousness of a headache and a stomach ache and a backache of irritable bowel, most of the patients that I see, I'm not practicing as a GP. Most patients I see, sadly, have chronic complaints, symptoms, diseases that they've had for a while that are being treated, that have been diagnosed. And if more diagnosis is necessary, not my bailiwick, I will make sure that they see a specialist, get the right test. We need to know, again, the biology of what's happening here as we treat it. But as we look deeper, the consciousness, when any experience that keeps repeating, you've had the symptom for a while, what's your relationship to it? What's your attitude to it? What's your belief about it? Is it connected to something that happened? Are you holding on, as he expresses in that, all of the pains that we can be free? We contract around it. That's the exile. That's the place that gets buried and squeezed and pushed down and contracted around, etc. Which is interesting. I'll use this analogy. It was my first talk I gave once at a senior center years ago. I would come in and I wanted to share this sense of carrying the burden, to let go the stresses, speaking at a senior center audience. And I borrowed people's purses and books that they had. And I said, I want you to imagine you're walking into a doctor's office. One of the cases I'll speak about perhaps in the next session. You're coming into the doctor with severe back pain of long duration, and you carrying it, and you go in and you get the x-rays and you get this and you get the tests, etc., and this pain has been there and nobody can figure out what is it, the neurologist and this, and all of the treatments and therapies are being looked at and tried. They help. There's remission, exacerbation, which can happen quite often in chronic complaints. And I'm carrying this stuff, and I say, I just want you to imagine if somebody walked into your home and they had on their back, they were carrying 3 bags and this and that and this on the arms, and they're walking around like this. And they'd say, my back hurts. What would you say to them? Lay it down. What are you carrying that stuff around for? Of course your back hurts. Well, that's an obvious example. The reality is we're carrying that in the same way. We carry that as a burden. It's heavy. It's heavy on the heart. It's heavy on the mind. It makes us anxious. It makes us sad. It makes us depressed. It causes headaches and stomach aches and back aches. This is not woo woo stuff like it thought was 40, 50 years ago. This is science with research that what makes us sick. We'll speak later. The number one stressor in a person's life is death of a spouse. So if that happens and you don't grieve and you don't deal with the feelings and you don't process the emotions, sadly, you're likely to get sick because the suppression of that, the holding on to that, the contracting around that Jack Cornfield speaks about, that's the suffering. And the paradox, which I mentioned before, looking at the big picture in these living questions, is there's two kinds of suffering. You can keep walking around like this, you can keep carrying it, you can keep the splinter in, which hurts, which causes disease and pain, and you bring it, and we want relief, and we should get relief. And not, again, however, we want to heal it, we want to be free of it, we got to find a way to let go. And there's many tools and techniques. I found mine with living questions, how I work with people to open to it, to listen to it, to see as a teacher, to live these questions. And in that process, to have the choice for the suffering that leads to the end. You mentioned that last time when we spoke. Why would people do that? They want to get fixed. Well, because that's healing. Why does somebody go to a 12-step meeting and stop drinking and go through withdrawal and go through pain and all? Because the pain of continuing drinking and being an alcoholic is worse. This pain leads to healing. And so
Right.
that's the journey. And this next step in the process of unburdening, of letting go, starting from the patient with dis-ease that tells a story, with a symptom, with a pain that's a teacher, is are
Okay.
you willing to listen to it more deeply?
All right. Now, so you've had many patients appreciate what you have done for them by helping them open up those ears in their hearts. And here is something that I want to read from a patient of yours who learned how to listen and saw their situation with, quote, new eyes. She says Dr. Epstein has a unique ability to enable his patients to see their situations with new eyes. His skillful investigation, along with his tremendous openness of heart, allowed me to finally open my own heart to include even the very illness which I had been fighting so hard to get rid of. Ironically, it was through this deep acceptance that real healing finally began, spiritually, emotionally, and physically. Wow.
Mm. As I
So,
shared with you, everything I'm telling you, I learned from whatever my experience is in healing and my practices and my journey through my life. But and from studying this technique and this tool and this therapy and going to school forever and being on workshops and trainings with this teacher and that, my teachers have been my patients and their willingness to live these questions and the courage that they have to look inside and be with the parts of them that are wounded and to trust me enough because I know I wish I had a magic cure and an instant answer to fix them. And if we have it, I'm going to send them there and get it. And sometimes we do. Sometimes there is the pill, the surgery, the treatment, conventional, natural, herb, drug. Of course, we want that too. All of it's integrated. There's no absolutes. There's no one way. Uh, Paths are many. Truth is one. Therapies are many. Healing is one. What's the truth for this patient? Where's the healing for this patient? These are the questions that I live. And when I'm asking them to look inside, I'm saying to myself, are you helping them see the truth? Are you helping them live the questions? Or are you engaged in helping them fix it and get rid of it? We want both, but the work of the living questions is to integrate the healing part of that journey.
okay. So, Dr. Epstein, there are tools that you use in trying to open up those ears of the
Right.
heart so we can listen. They are mindfulness, guided imagery, family systems therapy. Why don't you take them one at a time and tell us how those tools are useful to help us listen?
Well, let me use an example of a patient that was a main teacher of mine that will illustrate the need for these tools or the use of these tools or the efficacy of these tools therapeutically. which will again go into greater depth because they bridge all living questions. They go together. We're separating it out, but it's not a set. We did question one. Now let's do question two and three. It's an ongoing. We're going deeper into their bio, deeper into their listening. Next session, deeper into being with, seeing with new eyes, shifting of consciousness, relating in a new way. The healing journey unfolds. It's not, I cured you. The taking out of the splinter is not an automatic uh, thing as much as we'd like to. Everybody's at a different phase, different parts of them. So I will illustrate it with this woman who came to me with a common complaint of many people in our culture of weight and obesity, which is a struggle. Obviously now, fortunately, we do have a medicine, a drug that seems to be helping with the weight loss on a clinical level, the GLP-1 and other things. And that's the biological side. There's still the biology side, biography side to go with it. That's an important element too that I have found in my career. And again, integrating both. We still need to eat healthy. We still need to take medicines, but we also need to look deeper at what the mind body connection might be. So this woman had been struggling with weight issues her entire life. And like many people, she had been on many diets. Uh, uh, Diets work. You lose the weight, but it doesn't last. So it's not a permanent solution. Um, and she was on, doesn't matter, just to name, Diet Center, Nutrisystem, Granny Craig, Oprah, Weight Watchers, all of them. And the reason they're all there is because they work and then they don't work, and they work and then they don't work, and then they don't and they don't work, and then the person's back to the same place, and eventually maybe they'll end up in my office. And why are you here? Because I'm need to lose weight and I'm overweight. And my doctor said you have to lose weight. Your diabetes is getting out of control. Your back pain is getting worse. Your digestion isn't helping because overweight, obesity is not necessarily healthy for the other systems of the body. And we're not judging, blaming, and then there's the struggle. And there's no one diet that's right for anyone in that sense. And diet is an important element. Of course, a person has to eat properly and exercise and deal with their stress. There's still that lifestyle component aspect that we mentioned in the first session about Califrano. You, the individual, can do more for your own health. So, in the process of living the questions, I asked Mrs. Jones, we'll say, um, so why do you want to lose weight? And her comment really, this was years, many years ago, early in my career, when I was beginning this exploration to move more fully into sort of the healing elements of it and exploring the deeper issues of stresses and traumas and how they play in a person's life and how to integrate it into their clinical care, their medical care, and their symptoms and diseases as a whole, as a healing soup. And she said to me something that was really profound, and I remember it to this day, and why I explore change how you look at it, change how you be with it. It heals. Her attitude, her response was, because I'm fat and ugly and I hate myself. I just lost another 50 pounds and I gained it back. And I've done that my whole life. And I'm miserable. I can't stand myself. So here's a person suffering from the issue of weight, wanting to lose, going on diets, losing weight, and somehow falling into the hole again, that repetition posture. The issue is not necessarily weight, it may be the addiction to dieting or the need to get rid of it. Not that one ought not want to lose weight, but the question is the weight a symptom? Is it a teacher? Is there a meaning and message? And of course, we want to help the patient lose the weight. And I said, well, Mrs. Jones, I'm a naturopathic doctor. You hadn't been to a naturopath before, per se, but you've eaten a lot of good foods and been on a lot of healthy diets that have helped you. But here you are again. So we want to take a little different approach. We want to live some questions. And in the interest of this session and guided imagery, and am I willing to listen to it? I said to her, well, I can give you another diet. And I think it might be a little more customized, individualized than some of the places you've been to because it's more universal. It's not as individualized. And I'm trained to work on your metabolism and work on your digestion and order tests and understand your blood sugar and understand your digestion and other aspects that may be affecting your food and your metabolism and your microbiome now to understand what's happening. And all of those are critically important. And it's not my bailiwick anymore as I moved more, as you obviously know, now to more mind body and explore that element in their soup and integrate it. And I realized in that moment, and then I said, "What are you willing to listen with your heart? This pain, this fat, this wound, this weight issue that you've been struggling with your whole life. Of course, I want to help you fix it. You've been suffering, and you're not getting anywhere. You keep falling in the same hole, and here we are. I don't want to give you another diet that might work and have you be in another doctor's office in 6 months. I'd rather explore a little deeper. We may give you a better diet, but before we do, I want to say the following. I'm happy to help you with another diet, but I want to work on when you tell me that you want to lose weight because you love yourself, let's work on it there. And so, are you willing to listen? Let's explore your relationship to the fat. Are you willing to listen to it? It's been there, you get rid of it, it keeps coming back. You lose the weight, you don't keep it off. You fall back in a hole with whether it's your diet or whatever. It's not that you can't lose weight. Many people, these diets work for a period of time. And the people either don't stay on it or their metabolism or there are other factors needing. But the psychology, the consciousness, the attitude, the relationship to that fat over years and over only seeing doctors, again, doing good work, whatever it may be, or clinics doing good work. I'm not here to negate anything. It all works. It's all part of soup. But here she is. And she said yes. She had finally, was she willing to do some suffering that would lead to the end of suffering. For me, another diet for her would be more suffering, more of the same, another drink, even if it worked for a while to take that pain away. So she now had the pain of a lifetime of struggling with weight, of losing and gaining, and hating herself and being ashamed of herself. And she's a lovely woman with family and a life, but that part of her, she's in pain and she's suffering. And sadly, there may even be a deeper pain, which this is covering up. And so the challenge in the healing is this both as recognizing the pain you're in, which hopefully leads you to a 12-step meeting for some people and saying, I'm an alcoholic, I got to stop. That's the pain, that's hitting bottom. The question of seeing the truth of the pain, did she hit bottom or would she come back or did she need me to give me another diet to get out of that space? And at that moment, I said, I can't give you another diet now, but let's listen. Are you willing to listen? And she said, yes. And we had a connection and we were working on it. And we were talking about bio, but she didn't necessarily share too much of her bio. And we sometimes people don't know what it's about. So we have to go more into the subconscious and some deeper wounds, as I shared to you, which I'll speak more about later, of the trauma of my dad that I live with. No one's to blame, but didn't really appreciate or understand it until after he passed away. And I carried that in my way, which brought me to my career in this way of working with people in my healing, in my mission, in my purpose, in my pain. And we did guided imagery, and Sheila mentioned, so what are some of the tools? Guided imagery is one. Mindfulness is another. Yoga relaxation is another. Internal feminist is another. And I'll show you with this particular person how all of those elements are in play. So I had her lay on the table. I said, Miss John, we're going to do some guided imagery. We're going to listen to your symptom. There's also listening to your inner wisdom. To do that, we have to stop, we have to relax, we have to create a safe space. Again, recognizing that what's underneath, not just the pain of I hate myself and I'm ashamed and I can't stand this, but maybe a deeper pain and a deeper wound. And where that leads. And we have to be gentle. And it's called trauma informed. We're not forcing it. We're not breaking it open. We're creating a space where when it's ready, it shows itself. It tells the truth. It speaks its mind. The body speaks the mind. And I'll never forget this because this was powerful. This was early in my career. I was studying guided imagery with Martin Rossman, medical doctor from the Academy for Guided Imagery. As I shared, I was studying guided meditation and mindfulness with Jack Cornfield. I had studied yoga, beginning to study various psychotherapies to integrate, to know how to work with people and their pain from a mind body standpoint and integrate that in different tools and technique, but mostly helping people connect to their own pain and their own truth with a space of compassion and love. And close your eyes, Mrs. Jones. Let an image represent this fat that you've been hating, this weight that you've been trying to get rid of for the last 30 years. It goes, it comes back. You can't get rid of it. As much as you hate it and hate yourself, it doesn't go. Let's listen to it. Let's explore it. Why it's there. Does it mean something? Is it telling us something? Well, immediately, again, I'd seen her a couple of times, other aspects of my work and our relationships, and integrating these living questions and exploring her bio and what was happening in her life now and who she was and all of that to get to this point where she's on the table. Let an image form that represents this fat that you spoke about. I hate myself. I'm fat and ugly, and I got to get rid of it. And immediately, she had an image of a down comforter. And something happened. There was a shift in her expression, her experience, her connection to herself and to that fat that was like an insight. Oh my God, my fat is my friend. My fat is protecting me. This is a concept in internal family systems therapy that we have different parts of us. I've mentioned we have a part of us that carries those deep wounds, that carries the trauma of being abandoned and abused in our lives, in our culture, the wounds that we carry, the traumas of the day. I could be speaking at any point and open the news, and sadly, the news today with people, whenever you hear this, the killings at Brown University, the killings, the horrible killings in Australia uh, on a holiday, um, attacking Jewish people. We're all human beings, citizens of the world, traumatized by living through this stuff, and we carry that. We carry those pains with us. So yeah, she got this image of a down comforter, and that shift in relationship to, oh my God, it's protecting me. I could say that. I could tell her that. I can tell her she's carrying that weight for a reason, and it's protecting her. That's the context. That many of our symptoms protect us from a deeper pain that we're not ready to feel, from the simplest of the child not going to school the next day because they didn't do their homework, so they get a stomach ache to protect them from having to show up at school without their homework, to the pain of I was sexually abused as a child, and my way of dealing with that was to cover it up with fat to feel safe. Not for the doctor to tell her, for the patient to experience that truth and to guide her to explore that and to find there's another place in her as a mom, as a grandmother, that has the capacity to embrace, to touch with mercy, to remember it instead of keeping rejecting it. It was a part of her that was scared and helpless and needed love, and she had been rejecting it and pushing it away her whole life. And she had the cognitive understanding, as said in Jack Cornfield's quote, when any experience keeps repeating in consciousness, it's asking for a deeper and fuller attention. She's paying attention to it now. And we brought in, again, can't go through the entire process. This is briefly some self compassion, to start to have compassion for self instead of I hate myself. Some compassion for herself and that little girl. Some ability to now start to tell the story, not to relive it, not to re traumatize, to release it. We now have, sadly, we know about what happened with Bill Cosby, the people who were abused by him, whatever issues they had, mind and body. You could see they carried it 20, 30 years later. We have the people now with the serial sex offender, sadly, with my name. Um, and thousands of women carrying around that burden, screaming, We need to get this out. We need the truth to come out. We need to, for our healing, we need to be seen. We need to be heard. We need to tell our truth. We need to tell our story. We need people to listen to us, validate us. We have wounds. We need to embrace those when we were little girls, etc. I'm using that as an example because this was this case, but it could be any issue in a person's life that gets buried and pushed away. The uniqueness of my living questions is I do it from the point of medicine. Now, this is happening obviously in therapist offices, but the patient came to me for physical, clinical issues. Yes, anxiety, sometimes stress, etc. But a lot, this disease, that symptom, that is a headache, a stomach ache, etc., skin diseases, psoriasis, whatever the case may be, asthma, allergies, needs clinical treatment. But there was a deeper message there to listen to, that in some way there was a protection somewhere. And the healing is a simple one. The patient themselves has a part of them that has the strength, the capacity, the courage, the clarity, the commitment, the connection, the creativity to be willing to be with themselves, because that's the medicine. I'm just creating that space, but I'm witnessing. And what I do is try not to fix them, not to rush it, not to force it. Recognize there's a part of them really scared, that like that little kitten up on top of my desk. And it needs patience, and it needs trust, and it needs to see with new eyes. And it needs to be an environment that is accepting and not striving to fix them and get rid of them and get rid of it. So the journey shifted from I need to lose weight because I'm fat and ugly to there's a part of me that I need to listen to that's scared and helpless and needs love. And my fat is my friend. So that was the first shift. And she had to bring mindfulness to that and being present with that and being willing to practice self compassion. There's a part of me hurting and wounded, and it needs my love and compassion. Can I be happy? And I'm not alone. This is not just me. Everybody at some point has some level of abuse or abandonment or neglect in some way, whether it causes disease or not. Why not heal that? What are we doing here to carry that stuff around? To me, the symptom, the issue is just a messenger, an opportunity to say, let's heal that so we can heal, so we can grow, so we can awaken, so we can. I wrote a little book, Happiness Through Meditation. Why are we here? What am I? I'm hearing it. Yeah, I'm here to fix people, cure people, take away their pain, which I can't do. I'm here to help them be with their truth, and I'm helping to find happiness, to be happy. That's what we're here. That's what we're quote unquote struggling for. How do we be happy? We got all of this stuff that we're carrying around that kind of gets in the way, and we let go. I'm recently semi-retired. Boy, I had to get out of my house, let go of my books. I couldn't believe how hard it is to let go of these books. I didn't need them anymore, but I had walls and walls and rooms of books that I gathered and kept. I was addicted. I was, I needed them. I didn't want to let them go. I didn't have to read them anymore. So Mrs.
Okay.
Jones was then able to open to the truth of her story. She didn't tell it to me in the bio. It came out in listening to with the ears of her heart.
So, Dr.
Really
Epstein,
bad.
let's
Yes.
let's talk about all of these principles by going through some of the slides you provided me with. And here's a quote. Perhaps all the dragons in our lives are princesses who are only waiting to see us act just once with beauty and courage. Perhaps everything that frightens us is, in its deepest essence, something helpless that wants our love.
So that,
Letters to a young poet.
Sheila, for me, I'm a quote addict, or I'm a truth addict in a certain sense, because to me, when I read that, or I read Jung, or I read Einstein, and quotes that have deep meaning, philosophical meanings, uh, it's like the truth is speaking, and I take it as 2 plus 2 is 4. There's a part of us that's helpless and wants our love. And the living questions are designed to help you go home to that place. That's often what the pain is about. It's a part of us saying, please see me. And we don't, because we don't have the resources, because we can't help them. And like I said, only they can do this in remembering and healing. They can't do it alone. So I just create a space to mentor them, to teach them, to guide them to come home, to be with their truth.
Okay. Well, let's go back to some of the principles of this session.
Okay.
And we start with mindfulness. To talk about mindfulness is about paying attention and listening within, as is mind body healing.
Yes. So that's, I moved from yoga practice, which was my initial movement into my own self healing, my own awakening, learning, seeing the world in a new way, from my pain, as I shared with my dad's passing and what it opened me to. And mindfulness is the moment to moment experience of your mind body process through a calm and focused awareness without judgment. It's being with yourself. It's actually an act of self love and self compassion. It's saying, whatever's happening, like Rumi says, is a guest house. It's my teacher. I welcome you. My knee hurts. I don't go, get out of here. I don't want you. No, I may need to do something, but you're here. You're my knee. I embrace you. Oh, I got a negative thought. How do I be with that? Not how do I push it away and detach from it. Not how do I get caught in it and let it pull me. But I'm not attached. I'm present with it. I'm witnessing it. It's okay. And I'm creating a way of being, a way of relating by seeing clearly. If you remember, we have things, name it to tame it. So we have to first see. So Mrs. Jones, we were giving her a sense of mindfulness, of presence, of training her mind and heart with both awareness and attention, and that brings a choice to face it and open with compassion. She could see the conditioning she had developed over 30 years of, I'm fat and ugly, I hate myself, I got to get rid of this, I got to get rid of this. And then here it is again. And then she always had the choice, move towards healing, touch with mercy, open with compassion, be with that truth, be with that pain. Diet was not the answer. Yes, she has to eat healthy, but she didn't need me to tell her, don't eat this and don't eat that in this particular instance. Now, these
Now,
are the
these,
seven
yeah.
intentions, and they
Mhm.
go along the main teaching. This comes from a book by John Kabat-Zinn, who has integrated mindfulness in healthcare with his mindfulness-based stress reduction. And from his book come these seven intentions, which we'll be speaking at the next session on how to be with. They answer the question, how do I be with it? And this is what I helped Mrs. Jones do, how to be with. It wasn't just, oh, yes, my fat's my friend and I got to get rid of it. There's a wounded child underneath there that's carrying the pain of being abused. How do I fix it? Get rid? No. How do I not judge it? How do I be patient with it? How do I have a beginner's mind, which is said, in the beginner's mind, there are many possibilities. In the experts, in the in the beginner's mind, there are many possibilities. In the experts, there are few possibilities. So paradoxically, I try not to be an expert. Every patient is different. Every symptom is different. Every two patients with weight may have a different story and a different symptom. And one may need an herb, and one may need this drug, and one may need deep healing, and one may need whatever. We're listening, we're exploring, we're integrating biography and biology. Number four is creating trust, developing basic trust to trust the process. Okay. And non striving. This is the biggest challenge. The way to do is to be. And I emphasize this again when I would train and I would ask doctors in the audience in workshops or trainings that I would do, how much time have you spent in your career in medical school and programs learning what to know and what to do? 50%, 70%, 80%, 90%, 90%. How much time have you trained in who you are in your own healing of your wound as a wounded healer? How much time have you trained or spent in how you be in your relationship to yourself and the patient? And what if it's true? Some people need the expert surgeon. But what if it's true that some of your patients need more of who you are and how you be, and all of what you know and do isn't healing them and may not be curing them either? So these intentions are healing intentions. Acceptance, radical acceptance. That was what that patient said. He came to get rid of, to get rid of, to get rid of. And I didn't help them get rid of. I didn't help get rid of the fat. I helped them see it with new eyes. I helped them be with it. I helped them listen to it and open to it. And that began the healing. Then we could eat a better diet. Then we could do what's needed to fix it and cure it. But the main energy is to let go. This is the final, which is our next session on question 3. How do I be with it with wisdom and compassion? How do I let it go? Let it be. When, and again, that's again amazing the power of love, of just embracing. And if you want to think of it in the most simple way, and I keep trying to find simple ways to share it, and speak about it with all these therapies and all this science and all these techniques, and everybody's different. There's tell me a story. Let's listen to it and let's be with it with love so we can let it go by letting it be.
So
That's the
here's
challenge. That's the challenge.
right. Dr. Epstein, here's our preview of the living question number 3 for our next program. How can I be with the truth of my pain that is wise, compassionate, and healing? So, finish up talking about this living question number 2. Final thoughts on that, and then we will prepare for our 4th program, which is the 3rd living question.
Well, first, thank you again, Sheila and Cable TV for the opportunity to share my truth. And I get in touch every time. I'm at the waning stages of my career. I still love it. I'm still passionate about it. Uh, I'm not letting go, but I'm exploring different ways to be with it. So I'm just noticing how much I'm excited to be able to share this uh, my experience and what I've learned over 40 years of practice, 50 years of in the field of health and healing and mind body and I just hope it's of support to people. And I want to keep it as simple as possible. Uh, the healer you seek is within you. The answers you seek are within you. Uh, let's live the questions. Uh, uh, no one has all the answers. There's no magic pill or magic cure. Each of us needs to find the answers and the truth for ourselves, um, and in that will be the healing. And we'll go a little deeper into that in our next session.
Great. So everyone stay tuned for program number 4. Until then, bye from Talkback. See you next time. Bye.